CAISS Head Exam. Question 1. What tests are used for the vestibulocochlear nerve? Checking pupillary response and eye tracking. Testing facial muscle strength and symmetry. Observing balance, posture, and gait. Rubbing of fingers, sound. Whispering. Tuning fork. Testing the gag reflex and swallowing. Observing balance, posture, and gait. Rubbing of fingers, sound. Whispering. Tuning fork. Question 2. Difficulty swallowing could be a sign of damage to what cranial nerve? Olfactory nerve/CNI, optic nerve/CN2, facial nerve/CN7, glossopharyngeal nerve/CN9. Difficulty swallowing could be a sign of damage to the glossopharyngeal nerve/CN9. Question 3. What nerve is damaged if the patient has no gag reflex or impaired sensation in the tongue? Vagus nerve/CNX, abducens nerve/CN6, trochlear nerve/CN4, oculomotor nerve/CN3. Vagus nerve/CNX. Question 4. What nerve is being tested when resistance is added to shrugging shoulders? Vagus nerve/CNX, spinal accessory nerve/CN11, hypoglossal nerve/CN12, trigeminal nerve/CNV. Spinal accessory nerve/CN11. Question 5. What nerve is tested by watching movement of the uvula? Hypoglossal nerve/CN12, spinal accessory nerve/CN11, glossopharyngeal nerve/CN9, facial nerve/CN7. Hypoglossal nerve/CN12. Question 6. Why are brain injuries coded in the first 24 hours? Because patients are discharged after 24 hours. Surgical and other interventions can increase the size of a contusion or hemorrhage, which would inflate the severity. Because the brain heals completely within 24 hours. It is just an arbitrary coding rule. Surgical and other interventions can increase the size of a contusion or hemorrhage, which would inflate the severity. Question 7. When do you code to the cerebellum? Whenever any brain injury is suspected. Only when the frontal lobe is uninjured. Only when cerebellum, infratentorial, or posterior fossa are mentioned. When there is a skull fracture. Only when cerebellum, infratentorial, or posterior fossa are mentioned. Question 8. Define brain swelling. Generic description of a swollen brain. A localized pool of blood. An infection of the Meninges. Specific type of brain edema with hypodensity on CT. Generic description of a swollen brain. Question 9. Define brain edema. A generalized term for any head injury. A bone fracture that compresses the brain. Specific type of brain swelling. It indicates increased brain water content. Should only be coded if the provider describes it as such or CT mentions hypodensity. A bleed between the skull and the dura mater. Specific type of brain swelling. It indicates increased brain water content. Should only be coded if the provider describes it as such or CT mentions hypodensity. Question 10. What section of the brain is the supratentorial coded to? Cerebellum, brain stem, cerebrum, medulla. Cerebrum. Question 11. What section of the brain is the anterior or middle fossa coded to? Cerebellum, brain stem, pons, cerebrum. Cerebrum. Question 12. How is a hemorrhagic contusion coded? As a laceration, as a hemorrhage, as a contusion, as an edema. As a contusion. Question 13. How are cerebrum brain contusions coded? By volume and depth, by number and laterally, by the cause of injury, by the patient's age. By number and laterally. Question 14. Diagnosis of diffuse axonal injury, DI, requires a coma over how many hours? 1 hour, 2 hours, 6 hours, 24 hours. Diagnosis of DIE requires a coma over 6 hours.